Hi, good evening for those of you who are watching this live, or good morning, depending on where you're dialing in from. We do have a few international guests, which is lovely. And welcome to those of you who are watching the replay. I know we're all really busy and I know how hard it is to find the time to do things for yourself. So the fact that you are here and watching this webinar and doing something positive to care for yourself and your C-section scar is great. Now, I'm really excited to introduce you all to scar massage. By the end of this webinar, I want you to know exactly how to get started, the exact techniques to use, how long to do them for, and when you know how to progress. So who am I to be taking your valuable time and teaching you this? My name is Sarah. I'm a physiotherapist and I'm a C-section mum to two little ones, James and Hannah, who were born 21 months apart via C-section. Now, I've been a physio for 20 years and the majority of this has been in a large teaching hospital in Brisbane, Australia with a huge maternity department. And so I've cared for hundreds of women who've had C-sections. But it wasn't really until I'd had my own C-sections that I realised that there is this gaping hole in the postpartum care for C-section mums, and very little information is given regarding how to care for your C-section scar, to make sure it heals well and to make sure there's no ongoing issues. So like I said, I have two little ones, James and Hannah, and they were both born 21 months apart via elective C-section. After my second baby, Hannah, I had a lot of trouble with my scar from day one. I had lots of swelling and bruising. I had really sharp pain on one side in particular, some patchy numbness, and it was just generally a lot worse than when I'd had James. So when I went for my 6-week postnatal checkup, my obstetrician was concerned that I was developing some scar adhesions. So when a C-section is performed, you might know there's several layers of tissue that are cut through to deliver your baby. Now, before your baby was born, all these layers of tissue moved freely against each other. But when the tissues are healing, they can actually become stuck together and no longer move freely against each other. And this is what we call scar adhesions. Now, when these tissues stick together, they can cause scar pain and sensitivity, but because the layers of tissue that are cut go quite deep, it can also cause lower back pain, pelvic pain, pain with intercourse, urinary incontinence, and there's also been some suggestions that it might impact future fertility. But the biggest complaint that I hear about is a tight scar tissue causing that C-section overhang. So the scar tissue pulls tightly underneath your tummy, causing this very pronounced overhanging look. So C-section overhang, shelf, pouch, pooch, wherever you're from. And no amount of diet or exercise alone will completely get rid of that if you have tight scar tissue. So this is where we need to do scar massage to help all of those layers of tissue start to move freely against each other. Now, I have developed a step-by-step guide that's going to take you from just beginning to touch your scar right through to deep tissue scar release. And if you stay until the end of the webinar, I've got a special offer for webinar registrants only. So let's get started. Before you start massaging directly over your C-section scar, it is important that you've had clearance from your healthcare practitioner at your 6-week checkup, just to make sure that it's all healed, no infection, no wound breakdown, no wound ooze. Now, if you are before 6 weeks, there are a few things that you can get started on straight away around the scar. So I will guide you through that as we're going. So I'm going to tilt this down and I'm going to demonstrate on my own scar. So just bear with me while I just move down here. Now, if you're online live, you let me know if you're having any trouble seeing here. Okay, so let me just slide this down here. Now, hopefully you can see clearly. Now, just for reference, my little Hannah has just turned 2. So this is a 2-year-old scar here. So please, if you have a new fresh scar, please don't be comparing your scar to how this looks. This is quite a mature scar at this stage. So what we're going to start with is just some simple circles around your tummy. So what you can do is just get a small amount of moisturiser or oil just on your hand. Now, it can be anything, doesn't need to be anything special, but try not to have anything with too much scent in it. You don't want anything that's going to irritate around that scar at all. So just put a small amount on your hand, and what we're going to do is just do some clockwise circles to start with just around your belly button. So now if you are not yet 6 weeks post-delivery, this is absolutely fine to start here. You can just see that you're going to start to get a little bit of overflow movement to that scar area, but we're not actually touching directly on the scar. So if you're before 6 weeks or if you've just started scar massage, you can start doing large clockwise circles around your belly button And you're going to do 3 sets of 10 of those. Now if you're past the 6-week mark, and if you're starting to feel comfortable, you're going to take those circles to get closer and closer to that C-section scar. So you're going to do nice round circles, slowly getting closer to that scar. And what you want to do is make sure you've actually got a little bit of drag underneath your fingers. So that's why it's important not to have too much oil or moisturiser on your hand. You don't just want to be slipping and sliding over your tummy. You actually want to cause a little bit of drag underneath your fingertips so you're getting some overflow movement to that scar area. So we're slowly getting closer to that scar area. And if you're past your 6-week marks and everything's healed and you're feeling comfortable, you can sweep those fingers now directly over that scar. So you'd be doing 3 sets of 10 circles where you're swooping the fingers directly over that scar and a little bit of drag up through underneath your fingers here, so it's some overflow movement to that scar area. So nice big large circles. Now some of you may have some trouble touching your scar, and that might be due to the physical pain of it or even some emotional pain, especially if you had a birth that didn't go as planned. You might be feeling really sensitive in this area. So what we need to do is start getting the tissues used to some movement. So we call this desensitization. So you could pick up a little makeup brush or a cotton wool ball or a tissue, and you're just going to, for a couple of minutes at a time, just run that lightly over the scar. So this is if you're really feeling uncomfortable about touching the scar, it's really sensitive, it's really painful, or you're just feeling that disconnect from it and you're not ready to touch it yet. So you can start by, like I say, using a makeup brush, a tissue, a cotton wool ball. The other thing that you could do is do it through your clothes. Or the other thing that I recommend is after you've had a shower, just putting a towel over there and just dabbing it. Again, just getting it used to some movement and some light touch. So that's your desensitization technique. All right, so we'll move into some more specific massage techniques closer to the scar. So again, you're going to get a little bit of moisturizer or oil on your fingertips. And for this one, we're going to be using a medium amount of pressure. So not so light that, again, we're just swooping and swooshing over the skin, and not really firm. So you don't want the pink under your fingernails turning white. That would be too firm. So just sort of a medium pressure. And what we're going to do is just start with 2 fingers with some little circles, and we're just going to go around the scar. So we're not directly on the scar yet. We're just going around the scar in little circles, just in the tissues above it. Now, if you need to, you can cup those, any excess abdominal tissue that you've got that might be sort of pushing down onto that area. You can just cup that and pull that out of the way. And you're just going to do little circles. As I said before, we go directly on the scar, we're just going around the outer edge of the scar. Now, when you get to this outside edge, make sure you come all the way to the outer edge of the scar. It's very common to be tight on one side more than the other. And then you want to go underneath the scar. Now, a lot of people focus on this area above the scar because that's where you've got a lot more of the swelling and that overhang, but it can be tight underneath there as well. So it's important to do your little circles directly underneath the scar. So little circles around. And you're going to do this for 2 minutes. So little circles around the scar, across the top, all the way to the outer edge, and then underneath the scar. Now, again, if you're starting to feel comfortable, your scar is all healed and you're feeling confident with touching directly on the scar, you can then progress to doing those little circles directly over the scar. Now, if you're only just 6 weeks postpartum and you're just starting to do this scar massage, it might take you a number of weeks until you're ready to touch directly on the scar. It should start to feel more and more comfortable each time that you do the massage. So if weeks have gone past and you've done the desensitization and you still really cannot touch that scar, then that might be a good time to go and see your local physiotherapist to have a little bit of assistance with the scar work. Otherwise, you can then move on to directly over the scar, little circles, and you're going to do 2 minutes at a time. Again, all the way to the outer edges. So this one, you're going to go from one outer edge, little circles, with a medium pressure under your fingers. All the way to the outer edges. Now the final technique that we're going to do is the same, it's just with 2 fingers. This one we're going to do an up and down motion. So again, cupping any tissues that you need to out of the way, and you're going to go up and down, starting at the outer edge. Again, starting around the scar, not directly on the scar. To the outer edge, and then underneath the scar. And you're going to do that for 2 minutes at a time. And gradually just getting closer and closer to that scar until you feel confident to do that up and down movement directly over the scar. And again, making sure you go into those outer edges. So just to recap, these early stages are some circles around your belly button, gradually progressing to being able to do the large circles swooping directly over your scar. The desensitization if you're struggling to touch that scar, so a makeup brush, a tissue, cotton wool ball, massaging through your clothes or through the towel. Then the first technique is small circles, working around the scar, so from the outer edge all the way across the top of the scar to the outer edge, all the way underneath the scar for 2 minutes, gradually working closer to that scar until you're able to do those circles directly over the scar. And then the final one is just some up and down with the fingers. Again, you're going to start around the scar, up and down, up and down, up and down, to the outer edge and underneath. And then as you start to feel comfortable, you're going to go directly onto the scar. So hopefully you're all ready to get started with your scar massage now. So these introductory techniques that I showed you will start your scar to getting used to touch and movement, and it'll help with scar pain and sensitivity, and it's going to help those outer layers of healing tissue. Now, to really help the deeper layers of healing tissue, we need to progress to deep scar massage and deep tissue scar release. So if you really want to prevent or improve your C-section overhang, you do have to progress to that deep tissue scar release. So I have developed a step-by-step scar massage instructional video that shows you exactly how to progress from not being able to touch your scar right through to that deep tissue scar release. So I will attach the link, and I have some special bonuses for those of you who have watched this webinar tonight. So you will get the complete C-section scar massage e-guide. I've also added a bonus abdominal muscle separation self-check guide to make sure that you don't have any abdominal muscle separation that might also be contributing to that C-section overhang. A lot of mums don't have that tested in hospital, so it's really good to check that. And then the complete step-by-step instructional video of the 3 stages of scar massage. Now, I will also offer you a virtual scar assessment where you can send me photos of your scar and your personal concerns so I can guide you along the way. Now, I can only offer this to a limited number of mums per month, so if the link is live, then jump on quick so you don't miss out. So you're going to get the scar massage e-guide, the abdominal muscle separation self-check guide, the complete step-by-step scar massage instructional video, and then as that added bonus, a free virtual scar assessment from me. So I'm looking forward to seeing you all on the inside. Hopefully you can get started with something tonight. Please email me any questions or concerns you have along the way, and I'm looking forward to sharing this journey with you. Good night.